Good morning. It was fourth day of our course, Vedic Yoga Therapy Level 2. Two important points which we discussed yesterday were the basic principles of yoga therapy and methods of examination, all those tools of examinations or points to be covered in the examinations. Let us first understand the basic principles of yoga therapy. Now, principle means actually the goalpost or the path what you want to achieve, through which what you want to achieve. In yoga, avidya, ignorance, is given the highest importance in considering diseases, because avidya only causes. Avidya means ignorance. You not having knowledge of particular thing is root cause of your suffering. Even in normal diseases also it is seen. What is diabetes? What is hypertension? Suppose I have got skin disease. Then what is this skin disease? When you understand your disease completely, logically, that helps you to cure or treat your disease almost 50%. For example, there are many people, they say that, okay, our sugar level is normal, diabetic people, but when we eat something heavy, even if we do not eat sweets at all, and if we eat something heavy, our sugar level goes high. That simply means their diabetes is induced, or their diabetes is somehow developed from a severe kind of indigestion. So if they take care of their digestion, their diabetes can be under control. Similar wise, if stress is inducing your sugar level, stress is inducing your blood pressure level, then controlling stress is the solution for your blood pressure, or controlling stress is the solution for your diabetes. So the first principle what we have kept in Vedic Yoga Therapy is to know what exactly it is. So avidya, so treatment of avidya is the first principle. It is really exciting because, as I told you, that I am first time, this is first time we are taking some course or something. This is the beginning. So many new things are coming in when I'm teaching the students. So all the definitions of yoga that I found in Bhagavad Gita, that I found in Shikhopanishad, I found some definitions from Patanjali Yoga Sutra, and somewhere I thought of using those definitions of yoga in therapy. For example, my favorite definition of yoga comes from Bhagavad Gita, Samatvam Yoga Uchyate. Yoga is equanimity, yoga is balance. If you see, not only physical diseases, but general miseries of our life, general problems of our life are because of this imbalance. Now, all tools we use to bring the balance in our life are part of yoga therapy, and that becomes the principle of yoga therapy. The second definition again comes from Bhagavad Gita, Yoga Karmashu Kaushalyam. That means the expertise or your expertise in your profession, your expertise in your work, or your expertise in your dharma, that is yoga. So if if we diagnose someone that he cannot do his work properly, or he doesn't do his work dedicatedly, then we can apply this principle of Yoga Karmashu Kaushalyam. In the same way, there are various definitions. We talked almost about 8 to 10 definitions, 8 to 10 principles of yoga therapy. Obviously, Patanjali's Yoga Chitta Vritti Virodha is one of the most important tool, or one of the most important principle of yoga therapy. Friends, I personally feel that somewhere, if we follow this root level of, or basic level of understanding about diseases, many so-called big problems can be understood. Yesterday I checked one case of autoimmune condition. It is the progression is such a simple in understanding. I mean, every single thing that we read in book in development of that disease was available in that patient. If she would have been taught how to live a proper life, what are the causes of blood vitiation, what are the causes for her vata imbalance, then she would have been avoided. She could have been avoided this autoimmune condition. So I'm really excited in sharing my understanding with the students and you all. Then we also talked about almost various methods of examination, how to get the information about patient and how to kind of compartmentalize that information, and how can we use that information in diagnosing the patient. Many more things coming up, so stay tuned. Today we are going to discuss in our class about the diseases, various diseases, and it will be the most exciting thing for all of us, because I am presenting there a different aspect of looking at these big diseases. Tomorrow I'll be sharing that. Stay tuned and help me to forward and share this information, like and subscribe my channel. Thank you very much. Stay tuned.